Carpal tunnel syndrome. It has become the quiet epidemic in this country, and it's costing millions of dollars in workmen's compensation.
So, is there a way to get patients back to work quicker? Channel 29 medical editor Dr. Larry Stoneburner lets you be the doctor.
Jenny Harris works in a hospital as a psychiatric technician. Her hands must do the same repetitive tasks daily.
There were days when the pain would get so bad I'd have to put an ice pack on in order to get through the day.
Dr. Al Swafford made the diagnosis, carpal tunnel syndrome.
This tendons get swollen and it puts pressure on this nerve. That's what is the carpal tunnel problem.
Swollen, overworked tendons are jammed through a bony area in the wrist with no room to give. True or false? Can carpal tunnel syndrome be caused by a bacterial infection? The answer is true.
A puncture wound of the wrist that becomes infected can actually cause carpal tunnel syndrome, and that's treated conservatively with antibiotics.
In Jenny's case, her problem was from overuse, and rest didn't help. It was time for surgery. Instead of a long incision like this, the procedure would be done through a scope.
And the technique has been really well-defined, well-tested, and it's an entirely different set of equipment and technique. Okay, ready? If you can't see it well, then you have to stop that technique and then go to the open technique.
The white band you see at the top is the ligament seen through the scope. The band is cut to make more space.
Those people who have it through the scope have a little less pain and are able to get back to work more quickly.
Jenny's recovery time will be cut in half.
I'm Dr. Larry Stoneburner, Channel 29 Eyewitness News.
Now, Dr. Stoneburner says early diagnosis of carpal tunnel syndrome is vital and surgery can be avoided. And once the nerve is severely damaged, then even surgery won't help.
Well, Gary Butterworth is here now with the summer that just won't quit.
That's a great way to put it.